Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
This is Phil Ferris, and welcome to our show. Never Too Late for Fitness Radio provides answers and straight talk about fitness, nutrition, and healthy lifestyles for people over 50. During each show, we talk to real health and fitness experts, solving real problems with proven solutions you can apply to your day-to-day life as soon as today. Today's guest is Dr. Michael Carberry, founder of Advanced Medical Integration, a nationwide consulting company teaching a fully compliant integrated medical model from 2013 to present. He is the founder of Apple Medical Corporation Corporate Wellness in Chattanooga, Tennessee, and is also the executive director of Dynamic Medical Centers in Chattanooga. Now, you have a very interesting background and journey into healthcare. So, Michael, I wonder if you would share that with the audience so they have an idea of what you're bringing to the party when it comes to your healthcare model.
Sure, Phil, I'd love to. I did not grow up wanting to be a doctor. My background, my license, my degree, I am a Doctor of Chiropractic, and I did not want to grow up doing that. I didn't even know anything about it. I actually wanted to learn how to run a small business and how to expand a small business. So when I went to undergrad school, I went to a school, Stockton University in New Jersey, and I got my Bachelor's of Science in Marketing, and I was gravitating towards developing small businesses. And what happened was I got out of school and I got hired by a company called Reuben Donnelly, which was a division of Dun & Bradstreet, a very large marketing company. And I was trained in advertising and sales. And I was doing that. And what happened was I met my wife when I was 24 years old, and we started dating. And my wife is a physical therapist, and she specialized in traumatic brain injury and stroke rehabilitation. And while we were dating, I had a serious neck injury. And it was kind of strange how I had the injury. I was walking on the beach with my wife. At the time, I was in really good physical shape. You got to realize I'm 56 years old now. But back when I was 24, 25, I was teaching martial arts. I was lifting weights. I was rock climbing. I was surfing. I was backpacking. I was really in good shape. I was with my wife and doing a 25-year-old guy's stupid thing to impress a girl. I jumped up on the lifeguard stand, and then I jumped back down to show her how in good shape I was. And when my feet hit the beach, my neck snapped, and I felt like I got struck by lightning. And I collapsed onto the beach, basically temporarily paralyzed, yet I didn't know it was temporary. I couldn't really move. I couldn't feel anything from my neck down. I didn't know what just happened to me. And luckily, I was with a physical therapist, and she wouldn't let anybody on the beach touch me. But in about a minute, I started getting the feeling back in my body. And when I got the feeling back in my body and I was able to function again, I started noticing this severe electric pain down my arm and up the side of my head. Well, it scared both of us enough that my wife took me to the emergency room, and the doctor there thought I broke my neck. So he started strapping me into a headboard and a backboard and telling me that we're going to have to find this break. And if we find the break, we're going to have a surgeon come in, and he's going to have to drill into your skull, and you're going to have to wear a thing called a halo for probably 6 months. Excuse me. And now my world was spinning. And so they came back out and they said, well, there's good news and bad news. The good news is you didn't break your neck. The bad news is we don't know what you did. So here's a bunch of medications, and here's a list of neurologists and doctors that you can go to pursue to find out what caused this. Good luck. So I actually started off in healthcare as a patient. Well, being married to a physical therapist and from a family with a very medical background, that I went the medical route, taking the medication, and after about a month of that, I decided, this is not who I am. I'm not a person who likes to drug myself up. And I realized that the plan was to keep me drugged to try to wait for my body to heal itself. And I knew there was something wrong with my neck. It felt different than it did before. And I said, I'm going to go to somebody who can actually fix it. So I went to a chiropractor. And it's funny, my wife's family was not really in agreement with that. They were thinking, you should really go to a real doctor and not a chiropractor. But I went to the chiropractor, and it impressed my wife tremendously. She said that, this is not what I expected. I was basically misled at the university she went to where she got her degree. And they led her to believe chiropractic wasn't scientific. And I remember her leaning over to me in the first visit saying, "This is way more scientific than I thought it was." So the chiropractor fixed me. You can guess the rest of the story. I was totally impressed by it, and it dawned on me, this is the small business I want to be in. So I quit my job against everybody's advice, went back to school, and in 1991, I graduated from Life University with a chiropractic degree, a doctorate of chiropractic, and then I went back to Pennsylvania, which is where I was from, and I opened up a practice, and that's how it all started. The reason I went to integration was this. I was seeing a lot of patients. In fact, my practice, because of my passion for what I was doing, grew so fast. I became one of the largest chiropractic clinics in the state of Pennsylvania in just the first couple of years I was open. To give you an idea how fast it grew, the average chiropractor sees about 100 patient visits a week. I was doing over 100 patient visits a day by myself. And what I started noticing, and I remember talking to my wife about this, I said, these patients are coming in and they're telling me they have a complaint that started, a couple months ago to a couple years ago. That's how long the symptoms have been going on. But when I looked at their x-rays, I would see old injuries and degeneration going back in many cases a couple of decades. And I would ask the patient, when did you get injured? And they'd say, I never got injured. And I would say to them, no, look at your x-rays. This is degenerating. It looks like it's at least 10 or 15 years of degeneration. And they would say, well, my doctor said that's because I'm getting older. And I would say, well, that doesn't make sense because, a couple levels down on the spine, it isn't degenerating, and they're both the same age. So I remember it troubled me that these patients were coming in with old injuries. When I would estimate how old I thought the injury was, then I'd get these patients going, oh, yeah, I forgot I fell out of a helicopter in Vietnam, landed on my back. Do you think that's caused my back problem now? Or I was in a train wreck and I flew across the train and smashed my head into the door and bent my neck like this. You think that's why I'm having these neck problems now? And, when they'd say that, they'd kind of look at me and go, well, that's the dumbest thing I could have ever said. Of course, it's what's causing my problem. But I started realizing that's what happened to me. I had a lot of injuries before I jumped off that platform. And people are walking around with chronic degenerative problems. And they don't realize they have the problem until they get the symptoms, which is usually the last thing to show up, not the first thing. So we were looking to find a better way to treat these patients, and my wife and I wanted to collaborate and have physical therapy and chiropractic together so we could address. In doing research for this, we found that when people have arthritic problems, they won't have the symptoms. They'll have them initially, but then they go away, especially if they take a drug to cover it up. But then what happens is their posture starts to change around the degenerated area. And postural problems are directly related to arthritic problems. So we thought we could create a physical therapy chiropractic clinic that not only addressed the degenerated area that was causing the symptoms, but addressed the postural changes that came from it. And in Pennsylvania in the mid-1990s, the Physical Therapy Association did not recognize chiropractic as a legitimate referral source. So we had to look at a different way, and that was bring medical people in, like a medical doctor, to order the physical therapy. And that's how it all got started. So then we started creating these medical clinics that had chiropractic and physical therapy in the medical clinics.
Okay. Now, people over 50, which is the primary audience for the show, as you say, have a lot of chronic pain. And that pain is usually an obstacle for them being active and getting fit. So how do you help those people overcome those obstacles with chronic pain and arthritis, and, like you said, posture problems? So what's your approach like in your clinic to help them overcome those issues?
Well, our approach is basically to try to bring movement back to the arthritic area. A lot of Americans still think that it's over movement that causes arthritis, and that's not true. Studies and research shows that it's a lack of movement, something that causes a restricted motion that causes an area to become degenerated. So what usually causes that is a trauma way back in their past, which creates scar tissue around the joint. And scar tissue is not flexible tissue. And what it does is it starts to limit the motion to the joint, and the joint doesn't pump the nutrients in that it should be getting because of that limited motion. I'll give you an example. If we took my arm and taped it to my chest so I couldn't move it, and we left it there for 6 months to a year, everybody would agree, well, if you do that, you're not going to be able to move that shoulder. You're going to develop frozen shoulder from that. And that's because adhesions form into an area that doesn't move properly. So what we're doing is we approach the arthritic problems that people have by putting more motion into the joint. And we do it on a very safe, very graduated basis through things like physical therapy and chiropractic. But we also do it with medical services because medical doctors can do certain safe injections with very benign substances utilizing fluid like saline solution or lidocaine or marcaine or procaine, which are very safe drugs that actually expand in the scar tissue and gently break the adhesions. And what we found is in doing that, we can start to reinstate motion back into the joint, and that's what pumps the nutrition into the joint and keeps the cartilage young and keeps all the tissues and tendons and ligaments strong and healthy and pliable and viable. If you don't reinstate movement to a joint, it will definitely degenerate, and that's why people get arthritis. What I just described is one of the most common ailments that human beings suffer with. Arthritis is listed as the number one chronic disease in America. And if you look at, reasons people go to the hospital, the number one is to be born. This is according to the Archives of Internal Medicine and the Journal of the American Medical Association. They said being born is the number one reason to be in the hospital, and spinal problems and degeneration from trauma and chronic degenerative problems is the number two reason to be in the hospital.
Can you give us an example of how a patient may come in initially, present themselves, and how they may progress during the course of treatment? What kind of expectations? Obviously, this is not something where they come in and then one visit they're cured and they have full range of motion and mobility in a knee or a back or elbow or whatever. But can you kind of give an idea of what it look like? Because it is different than what many people are familiar with, which is come in to a doctor, see him for 5-10 minutes, get a prescription, and say, see me in 6 months. So your model is different.
Right.
Can you explain what that experience might be like?
Exactly. We had a patient come into our clinic in Chattanooga. He was a sheriff in the local county, and he had injured his back, and they diagnosed him with failed sacroiliac joint, which is the two large joints at the base of your pelvis, and the joint wasn't moving properly. And he had been out of work for a year, and he was on crutches, and he wasn't even able to put weight on that leg because that's the main weight-bearing joint in the pelvis. For the there's two of them, one on the right, one on the left. So every time he put pain on that side or put weight on that side, he was in excruciating pain. And he had tried everything. He was on different kinds of pain medication, and they were talking about surgery and drilling the pelvis and putting screws in there to fuse that joint permanently together. And we're like, that's going to permanently disable you. You will not be able to be a sheriff. You will not be able to do the things you like to do. So he came into our office, and we put him on a multifaceted program where we injected amniotic allograft, it's called. And basically, that's a whole other conversation. But amniotic tissue typically contains things like stem cells, cytokines, hyaluronic acid, and growth factor. And so what we did is we injected this into his SI joint and put him on a rehab program. And in 3 weeks, he was back to coaching soccer for his kids and was able to go back to work after a year of being disabled. And all we did differently was instead of trying to cover up his pain, we addressed the functional deficit that was inhibiting his ability to work. Now, he had pain relief, but his care plan went more than 3 weeks. We had to retrain it. So when somebody comes into our clinics, we look to see, one, do they qualify for this type of treatment? We can't take everybody as a patient. So we make sure that when we bring somebody on, that they qualify. Sometimes we send people off for surgery and say, look, you waited too long. I'm sorry, but your options are limited and we can't work on you in this condition. You have to go get surgery. But most of the time, we tell people, we look at it and we realize, okay, we can put you on a program and try to help you avoid surgery. And that's the number one thing people come in to do. And we put them on a program. It can go anywhere from a couple weeks to a couple months, depending upon where they're at in the degenerative stage and how soon we got them. Obviously, the sooner the better. And we train them just like a physical therapist and a chiropractor would do. We do it all together with medical people supervising and doing the injections that are needed if the injections are needed. It's funny, people say to us, and this was said to me last week when I was in my clinic in Chattanooga, I don't do so well with needles. And I said, okay, well, how do you do with scalpels? And they went, I think I will do the injections. So what we do is we look to restore function. Our goal is not to cover up symptoms. Our belief is if we restore function, the symptoms will go away and stay away. If you cover up symptoms, what happens is the body comes back and says, well, I needed those symptoms, so I'm just going to turn them up, and now you have to take stronger and stronger medication. Does that make sense?
Yeah, that makes a lot of sense. Besides, you mentioned, the back area, what other kinds of ailments are typical for the types of patients that come in looking for help?
Well, we treat lots of chronic degenerative problems, and some of the most common areas, obviously the spine, low back, or the neck, but we see a lot of people trying to avoid knee replacement surgery. When I first got out of school, it was considered malpractice to recommend knee replacement surgery for somebody under the age of 50 because the replacements can't fix themselves and they wear out. From the moment you put them in, they start wearing out. And there's a limitation to how long they last. And they can only be done twice because you have to cut away part of the bone to put these replacements in. So if somebody starts that too early, they're going to be facing a situation where their option is going to be very limited, and one of the most common options is amputation of the leg. But I've noticed in our clinic in Chattanooga, especially in the last 10 years, that we're getting people recommended for knee replacement in their 30s. So we see a lot of people who are trying to avoid knee replacement. We see a lot of people trying to avoid shoulder replacement and shoulder surgeries, and people facing hip replacement. We have people with heel spurs, and we've actually, I didn't even know they could do this, but we had a physical therapist fly in from Boston to get treated for her thumbs. They were recommending thumb replacement surgery, and I didn't even know they could do that. But, she didn't feel comfortable going that path. She wanted to see if there's a way we could fix her, and we did. She couldn't even button her blouse when she started with us, and in a very quick period of time, just a number of weeks, she was able to get back into yoga, doing yoga poses on her fingertips. So, it's a matter of when you address function, it depends on how much is lost. It takes a matter of time to get that back, but it doesn't take as long as it did to get there as it does to get back. So what we're doing is just putting function back into a joint, and the body has an amazing ability to repair that. So everything from foot and ankle problems to knee problems to hip problems to shoulder problems and even carpal tunnel and thumb problems, we treat that. We also have people chronic degenerative or chronic headaches. And the research shows that most headaches, the vast majority of headaches, comes from a chronic degenerative problem in the neck. And when we address that, a lot of times those headaches go away and stay away.
Great. That's very informative because that covers a lot of ground. Mike, the concept of holistic healthcare has been around for quite a long time. But many people may not understand what it is and may have some misconceptions about it. So what are some of the biggest misconceptions people may have about a holistic approach to healthcare?
Well, holistic itself means whole, looking at the whole picture, as opposed to looking at, when I was in when I was in graduate school, I had to work to support myself, and I got a job working as a security guard in a hospital. And, a lot of times I heard in the hospital in the emergency room, because that's, where I worked mostly, because the emergency room is considered a high crime district or high crime area. So I was stationed a lot at night on the weekends in the emergency room. And I would constantly hear the people referring to, well, we have a knee in room 3, we have a shoulder in room 4, we have a low back in room 5. And I'm thinking, that's not the right way to approach this. The way to approach it is, we have a patient has a knee problem, let's find out why. So holistic in itself means looking at the whole picture and finding out what is the underlying cause. That's a more difficult task to take on. Give them something to cover up the pain might be advantageous at the time, but if that's your whole care plan, that pain's going to eventually come back, and it's going to come back worse. So what we're trying to do is find the underlying cause that caused that knee pain. And that it's kind of like an electrician finding out, well, why is the electric on the 3rd floor not working? It might not be the 3rd floor being the problem at all. It could actually be the fuse box in the basement has a bad fuse, or a circuit has popped or something like that. So to give an example, a lot of times when people come in complaining of right knee pain or left knee pain, when we look at that, we always look at both knees, because more than a third of the time, the asymptomatic knee is worse. And what they're doing is they're they're altering their gait or the way they walk on it and aggravating the healthy joint. So to try to figure out why the person's having the problems means zeroing in on the function and assessing the function of that area and related areas. We know that a lot of times people have knee problems because they have a chronic pelvis problem, and it alters what's called the Q angle. That's the angle that your femurs, or the bones in your upper thigh, angle down, and that's the upper part of the knee joint. So if the pelvis is chronically altered and you're walking incorrectly on those legs, I mean, it's just like having a car that needs a front end alignment. The tires are going to wear out faster. So if you're trying to fix the problem, you would go to a mechanic, and if they put tires in your car, a good mechanic would say, look, the way your tires are wearing down, we can tell it wasn't the tires. It was actually your frame or your alignment. You need an alignment as well. And the same is true for the human body. So what we're trying to do is find the underlying cause and address that so that it doesn't come back.
Now, I'm sure there's people that are considering a more holistic approach, but aren't quite sure what to look for. So do you have any suggestions for them for how they should go out looking for and finding a practitioner to be right for their kinds of issues?
Well, it's funny. I do a lot of lecturing, and whenever I talk to the audience, I say to them, the correct answer for every ailment is nutrition and exercise. And then I'll go through it with them. What's the best thing for heart disease? Nutrition and exercise. What's the best thing for being out of shape or musculoskeletal conditions? Nutrition and exercise. What's the best thing for depression? Nutrition and exercise. What's the best thing for digestive problems? Nutrition and exercise. And that's true. But the problem is nutrition and exercise means lifestyle change. And that's what people are afraid of. So the way we overcome that is by explaining the cause of the problem to the patient. If you go to a doctor of any discipline, the word doctor means teacher. And the doctor should be explaining to you why they believe you got the problem and what's aggravating the problem and what they're going to do to help relieve the underlying functional cause of that problem. And if the doctor isn't willing to explain that to you and how whatever they recommend, whether it's drugs or surgery or rehab or adjustments or whatever it is, if a doctor is not willing to explain that to you, well, then they're not actually living up to their job. The word doctorate means education. It's the highest degree in education is a doctorate. And the word doctor means teacher. So the doctor should be teaching you, this is why your body is not functioning correctly. This is what we're going to do to improve the function so it does function correctly. And this is how far along you are. This is the outcome that you should expect. We'll get you to 100%, or we'll get you to 90% or 80%. And these are things you can do to prevent having to come back in here in the future. And that's how we do it. The doctor should, if you're talking about arthritis, they should be looking at some current x-rays. MRIs are great, but they show soft tissue. If you want to see degeneration of a joint, the best medium to see that in is still x-ray. So doctors should be utilizing current x-rays and whatever other diagnostics are necessary to find the underlying cause of the problem. And they should be looking more than just the joint that you're complaining about. They should be looking around there to see what other contributing factors are causing this problem. And their goal should be, here's how you're going to functionally correct this. And the goal should be, if there's medication used, to ultimately get you off of the medication and to avoid surgery, or if there is surgery that has to be employed, sometimes there is, then here's the goal afterwards to make sure that you get to maximum medical improvement so you don't end up back in surgery.
That means that they should be talking to someone that really has a long-term investment in their ongoing care, as opposed to just treating the chronic issue at hand.
That's right. Well, our goal is to get our patients fixed, and sometimes that takes repeated treatments anywhere from a couple of weeks to a couple months, and just like a physical therapist would. And so we're looking to do that. One of the main things we do in our clinic is we evaluate every 2 weeks, and we use some objective tests to evaluate, like range of motion testing on a computer. And we also do what we call a functional physical exam, which is assessing how the muscles function. Are they functioning correctly, or are they not? When somebody has a painful muscle, which is the most common problem people have with degenerative problems, is painful muscles, the idea should be to find out why. And I can tell our doctors this when we train them. Every time somebody has a painful muscle, it's because there's a muscle somewhere in the body that's not being used, and they're trying to make up for that by using another muscle to do its job. For example, a lot of people get tight trapezius muscles in their shoulders. And what we find chronically and in the vast amount of time, they have weak lower muscles that are between their shoulder blades and then their mid-back, and that's what's causing their upper muscles to get very, very tight. So you don't want to just treat the ones that are painful. You got to strengthen the ones that are weak if you're going to prevent it from coming back. So this employs different licenses. You know, people that are experts in exercise, people that are experts in the function of the vertebrae, which would be the chiropractors, and people that are experts in overall assessment of the body, which would be the medical people. So if you're looking for somebody to help you with your problem, you should go to a multidisciplinary clinic that is integrated, which means they're not just different licenses under one roof. They're actually integrated, meaning they're working together and collaborating, all treating the same patient. Our clinics, the medical license runs the show clinically. They're the ones that makes the ultimate decision because they have the highest license. And they supervise the chiropractic and the physical therapy underneath their direction. And that's how we do it. And we utilize, like I said, x-ray and different diagnostic tools to make sure the patients, we understand what's causing it and that they're getting better as we improve them.
And your option to a integrated practice is you go to one office for one set of, one thing, then you got to go to another office, and then to a third office, and maybe a fourth, and you hope that those people are all on the same page and communicate effectively for your treatment care.
Exactly.
And I've done that, and I find that the amount of time explaining things that one doctor needs to tell the other doctor or the physical therapist really didn't add to the overall experience, or it did not help me get a faster outcome. That an integrated practice where they are together saves time and increases the quickness in which you recover. So again, I'm a strong advocate of the holistic approach and the integrated approach as well.
I agree. I mean, if you look at it, if I could just say one thing along those lines, Phil, there's a lot of people who go to different doctors and are prescribed different drugs. And since the doctors are not coordinated, sometimes those drugs are a deadly cocktail. And there's a lot of people that suffer from that. Having an integrated approach where everybody's on the same page not only is more effective, but it's a lot safer as well.
A way of avoiding communication issues that may be inherent in that different offices trying to talk to each other. So, Mike, this has been really interesting because it seems a way of a wave in terms of healthcare is let's put the overall outcome of the patient ahead of everything else, and let's give them what they need to not only fix what they have now, but also the underlying cause so that they can have a longer, healthier, happier life. You don't want them coming back for problems. You want them to get healthy and develop the lifestyle they need to maintain that. So very impressed with your approach, and I want to thank you so much for being on the show and sharing your insights with us.
Okay, and if anybody's looking to find a clinic like this, if I can just give some contact information, is that okay?
Yep.
We're not sure if we have one in your area, but we have doctors all over the country that do this. And if you want to reach out, you can send an email to support@amidoctors.com. So that's SUPPORT at AMIDoctors.com. And we'll try to help find somebody that can help you with that problem.
All right. Is there any other place that they can go for information?
That's pretty much the best way to do it, because all these clinics that we've created, we don't own them all. They're individually owned, and these doctors have hired us to set that up. So probably the best way for us to help find if there's a clinic in their area would be to go there. Certainly going on the internet and doing your research, making sure the doctors are utilizing some of the techniques that we talked about would be an advantageous way too. But if you get stuck, reach out to us and we'll see if we can help you.
That sounds great. Well, thanks a lot, Mike.
Okay, Phil. Nice talking to you.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.